Parent-child interaction therapy, in its current version, was created in the 1970s, and there was kind of a movement to integrate the play therapy that was happening at the time, along with some of the behavioral parent training that was happening at the time. And so what PCIT did is it was also very important to incorporate the parent as the person actually doing the therapy. And so that's one of the things that's particularly unique about PCIT, is that the parent is in the room with the child and the therapist is not for the bulk of the session. They're on the other side of a one-way mirror, or currently it can be done via telehealth. And they are coaching the parent through skills. But the idea that was originally created is that there was going to be two pieces to the therapy. And the first part of the therapy was going to be a focus on teaching parents a lot of skills that are common for play therapists. So how to let children lead play, how to follow children in play. And then that was kind of merged with some behavioral principles on how to address behavior through the use of positive attention or lack of attention, right? How to use attention differentially. We talk about selective attention with parents. And then once we had this strong foundation built with parent and child, then we could move into a period where we were focused more on listening, reducing disruptive behavior, any kind of concerns that the parent had, and teach them behavioral principles, right, of kind of reinforcement and consequence, to help them address these concerns in a very systematized way. It's important to note that this is a treatment for kids from 2.5 to 7 years of age, so it's a pretty small age range there, and the reason for that is because prior to 2.5, we would say no, it's kind of a typical answer, and we actually have a really cool adaptation of PCIT called PCIT Toddler, but we usually say about 12 to 20 sessions would be a typical course of PCIT treatment. I would say PCIT is a great fit for any time that the child is experiencing any kind of disruptive behavior. So this could be tantrums, this could be trouble transitioning from things they like to do to things they don't like to do. This could be a kid who has trouble following directions. And the idea here, though, is that the therapy for the child is being done through the parent, right? So what we know as PCIT clinicians is that we could have your kid come in and they could work one-on-one with us and they would follow the structure, and we only have to be awesome for an hour a week. And so they might be listening perfectly to us, but that potentially is not going to help you at all when you go home at the end of the day, right? Because you have to maintain structures and consistency 24/7. Right, which is a very different thing. And so the idea behind PCIT with this parent coaching is that we were going to teach the parents the same skills that we would use as therapists. And so now you're actually able to do this kind of therapeutic effort all the time, right? So the idea is that in empowering parents to have these skills, now they can go and give this to their child, and they can go and make sure that it continues over time. So it's really about helping parents to build tools that will set their child up for success. So it's very structured, and some of the things that parents need to know when they start is that there is daily homework involved in PCIT. So we tell parents one of the things you have to be ready to do is kind of 5 to 10 minutes of daily practice, and that is an absolutely essential part of doing PCIT as a family. We have parents come in and there's kind of 3 pieces to this. So we set them up in a room with their child, we have them playing, the therapist is on the other side of a one-way mirror, and first we say just follow your child's lead, play whatever they want to play, and we're using this DPICS coding system to look at the things the child is doing, the things the parents are doing, what kind of skills might they be using that maybe they don't even know their skills that they're using. And then we move and we say, okay, now parents, it's your turn, right? So we do parent-led play. We say, okay, now your turn to lead the play, because we want to see what happens when that transition comes about. And then the final thing is our cleanup. And so that's the third part of that assessment, is we're wanting to see like what happens when we say, okay, the fun is done, the toys have to go away, kids have to clean up, right? And that gives us a chance to kind of see child and parent behavior across these 3 different types of interactions. We teach you all the skills that you need as a parent for PCIT. We teach you, we call them the pride skills. So we teach parents about the importance of praise and reflection, and we teach about imitation, describing, and having just fun with your child, enjoying that time. And then we also give them some skills of what not to do. And then after you do your coaching, we want to coach parents until they get their skills to kind of a certain criteria that we're looking for. And once you meet that criteria, then you're going to move into the second half, and you're going to do a PDI teach, where we're going to teach you about what the kind of system of giving commands and consequences looks like in PCIT. And then we say to parents, like, do you feel ready to take your skills and kind of go off and use them? And assuming that those things have all happened, then you would graduate from PCIT.